Are you on your iPad?
I am.
Okay.
Can you hear me okay?
Welcome. Yes, we can. Thank you. All right. Welcome, everybody, to tonight's testimonial call. We're excited to have Char Atwood, and she's going to give us her experience with LifeWave, like how she learned about LifeWave and her experience thus far. I just want to introduce myself briefly. I am Dr. Caroline Williams, functional medicine practitioner, and I've been practicing about 23 years in Las Vegas. And I learned about LifeWave from a representative for some of the nutrition that I use in my practice about a year and a half ago. And I was looking for a solution to help a patient that had major sleep challenges, among other things. And he was not able to be consistent with any kind of nutritional program. And so it was really a blessing that I was introduced to these patches because they worked wonders for him. And then I started to use them for myself and my other patients. So it's definitely the future for sure. So welcome, everyone. And I want to introduce my co-host, Nikki McCutchen. And Nikki, would you like to give our disclaimer, introduce yourself and give our disclaimer?
Yes, I will. Thank you so much. We are so excited that you all are here tonight. Just know that someone must really care about you that wants you to know about this technology and invite you to the call tonight. The call will be for 30 minutes, and if we have new people to the call, we'll be talking about the X39 patch that activates this amazing peptide in our bodies. And hopefully, Dr. Caroline will have a little bit of time to answer your questions. We will get started with our medical disclaimer. Dr. Caroline is most likely not your doctor, so tonight the information we'll be sharing is for informational purposes only. If you have any medical conditions, please check with your physician or healthcare practitioner. All LifeWave patches are not intended to treat, cure, diagnose, or prevent any disease. If you're on medications or have a medical condition or are pregnant or nursing, please check with your physician first. I am so excited for you all to hear and for me to hear fully Char's story tonight. It's amazing. We're so glad you're here with us. So, Char, if you would just tell us how you found out about the patches and what caused you to decide to use them and what you have noticed since you have been using them. And I think it's been a pretty short time, right, that you've been using them.
Yes.
Okay. Yes. So take it away.
Okay. Well, I am just very thankful that my dear friend Jody Trost shared Lifeway with me. She was up in Oklahoma and she came down to Florida knowing that I have been challenged for so many years with many, many different illnesses. And I just want to give a few things here so you guys know where I'm coming from. It started out about 30 years ago. I was diagnosed with Graves' disease. I had thyroid eye issues, endometriosis. I had Epstein-Barr. I had fibromyalgia, osteoarthritis. I've had 2 brain tumors in the last 12 years, stage 3 kidney disease, pernicious anemia, and a partridge in a pear tree. So anyway, Jody comes and when she came, I was having a lot of issues with my eyes. I was having a hard time even focusing on what she was showing me on her phone. I was telling her that I thought that Larry was going to have to place me in a nursing home because my memory was so bad and the brain fog was so bad that I couldn't remember anything. And at this point, I was taking care of him. He had been sick for about a year. And that's a whole nother testimony. But Jody patched me with X39 that day, left a few patches with me. And because I know and love her and have trusted her for the last, I don't know, 10 or 12 years, I said, okay, I'm gonna just trust you and I'm just gonna do this. And so we put in my order that day. And of course, when she left, I immediately started looking things up because that's my personality. Got to know everything about everything. And so the first thing I noticed was 2 days after, let's see, the second day after I was on the X39, I got it from the couch and I noticed that my knees were not in excruciating pain anymore. And I told my husband Larry, wow, this is something's going on here. And then later that afternoon, I noticed another issue that I've had with my mouth since the brain tumor and the pernicious anemia. The brain tumor was an acoustic neuroma, and it involved all of my cranial nerves, fourth through the eighth cranial nerve. And I had a lot of issues with my mouth, went to lots of doctors about my mouth. But by that second afternoon, my mouth felt totally normal. It hadn't felt that way in over 15 years. And I was amazed. I was like, Larry, something's going on. I don't know what is going on, but something's going on. Well, our patches got to us, and Jody recommended that we do X39, the Aeon, and the Carnosine. So those were the first three that we tried. And let's see, the eye surgery. When Jody came, as I said, I was not able to see very clearly. And I had gone to an eye doctor the next day, and he told me I needed eye surgery. That if I didn't have this eye surgery, that I had some kind of corneal mapping, that I was going to go blind. But he also told me that I was going to be in extreme pain for 3 to 10 days. And for both eyes. And he would do them a month apart. And that just did not sound right to me. So I went to another eye doctor, told me the same thing. So I got an appointment with a third eye doctor. Now I've been on the patches for 3 weeks. I went to the third eye doctor. He did all of his own tests, and he said, you're not going to go blind. Your eyes, I just want you to do a few things different with your eyes. You're going to be fine. And then I had blood work done. I don't know, a week, 10 days, somewhere like that, after I started on the patches. And I went to my general practitioner, and she was telling me how good my blood work was. And I said, well, what about my kidney function? And she said, well, it's normal. And she was a new PA. She wasn't used to seeing me. And I said, are you sure you're looking at my paperwork? Because I have stage 3. And she says, no, your kidneys are normal. And I said, well, I've been doing this new holistic thing. And she says, well, whatever you're doing, keep doing it. So I'm kind of interested in going back in 4 months and seeing what my blood work looks like then. I can also say that my memory is so much better. The brain fog has lifted. I can actually do things. I have the stamina to get things done, where I was just sitting on the couch all day doing nothing. My poor husband is looking at me wondering, what is going on with you? I've had arthritis so bad in my hands that my fingers had knots. I could not bend these fingers at all. Totally gone. All of my joint pain is gone. All the fibromyalgia pain is gone. Well, I don't know. Is it just a coincidence? I don't think so, because I don't believe in coincidences. So I really believe that it is the patches. We've since gone on Silent Night and the energy enhancer. And I think that's helping me a great deal. What else did I want to tell you guys about? I also, through the last few months, my blood pressure has been crazy, like 144/91 with 114 pulse, just sitting. And I've taken it in this last week, and it's 100 down to 106/73 with a 68 pulse. I'm not out of breath, just doing little things. This is just wild for me. I'm so amazed at what I'm seeing, and I just can't wait to share this with my friends.
Oh my gosh,
So
that is so
Amazing.
amazing. So how long has it been since you've been using the patches?
I want to say 5 weeks, maybe 6, somewhere between 5 and 6 weeks.
Oh my
Yes.
gosh. Okay. So let me make sure I have this right. You have fibromyalgia pain that's gone. Your knots and your arthritis in your fingers are gone. You can fully move, all of that now. Your blood pressure has gone down. Your eyes are better. Your kidneys are better. Um, your mouth is functioning better. Like your brain fog is lifted in 6 weeks. Like I am blown away. This is so
Oh my.
amazing. Yes.
Yes.
So amazing. Yes. Dr. Caroline, how could this happen so fast? What is going on with this amazing or all these amazing patches? What's going on with Char's body?
Well, definitely regeneration is happening. And for those of you who have used the X39, you know what I'm talking about because you've experienced it yourself. But what X39 does is it activates your stem cells, and then those cells can be made into any other type of cell to regenerate the tissue, right? They can be made into kidney cells, they can be made into skin cells, nerve cells, any cells that are needed. And the innate intelligence that runs the body is going to help determine that. Like we call it, it'll use a triage method of determining like what's most important at any given time for a person's survival on what tissues are most important to regenerate, right? So, and it's definitely a process. So it is truly amazing that just in the 5-6 weeks that all this has changed. That's amazing. Yes. Thank you so much for sharing with us, Char.
You're
It's
welcome.
truly amazing. Yeah. And definitely gives a lot of people, I think, hope for the possibility that if they were consistent with their use, that they could see changes as well. I mean, typically we recommend, for every decade, a month, right? So if they're 50, 5 months to really see, the significant change. So it truly is amazing that you've seen it so quickly. So I'm excited to see, what happens, over 5-6 months, what kind of changes you experience. So that's amazing. We definitely, the studies have shown a reversal of aging, especially starting at the 6-month mark, that there's a significant reversal of aging that people experience as well. So yes, this is truly an amazing technology. And that's just the X39. You mentioned the carnosine. The carnosine helps repair the nervous system, the cardiovascular system, helps reduce lactic acid buildup. So that's also tremendous. And the energy enhancer helps promote the flow of energy in the body. But these are non-chemical. These patches are non-chemical. They're just stimulating the production of these things within you. Your own body is producing these things, and it's unblocking energy, right? The ice wave, which we didn't talk about, relieves pain by unblocking energy. Many of these patches we're using on acupuncture points as well. The Eon, which is like one of my favorite patches, it activates the parasympathetic side of the nervous system, which is the state that you need to be in for healing to occur. It helps modulate cortisol. It helps basically just reduce stress and reduce inflammation. So that is excellent in and of itself. But then when you couple it with something like X39, it's tremendous. Yeah, you can see tremendous change. Yeah, so I'm so glad that you listened to Jody, and so glad Jody told you about it, and that you were willing to try it.
Me too. Wait till you hear my husband's story.
Yeah, I can't wait to hear his story. He's got to come on here
Yes.
too.
So,
Yeah.
Dr. Caroline, tell us. So, obviously, this I would say is unusual, possible, but unusual. So, what if someone is not getting those results or they're not noticing anything? What's going on with that scenario? Because obviously, with Char, like all praise and glory to God, like he's
Yes.
allowing these patches to stimulate what needs to be stimulated for her to have that regeneration. But what if someone is not experiencing some of the things she's experienced?
I think you have to look at a couple of things. One, you have to look at consistency is huge. So consistency is really important with the patches. That's like anything that you do, right? Whether it be nutrition, the patches, anything, consistency is key. And hydration is really important for these patches to effectively work. When you think about life force energy at all, our bodies are conducting it through our tissues, through ourselves. And so these patches work that way. It's a conduction of energy. And so you have to have adequate water and adequate minerals. There has to be a balance there between those two things for that to effectively happen. So hydration's huge. Placement can also be a consideration, especially specifically with the ice wave. Placement is very important to get the result as well. There's other factors that we have seen as well, depending on what kind of state somebody's in to begin with. If somebody has a lot of toxicity and say they've not worked on themselves in terms of like eliminating those things, you know, if they have done things like, I think what I've seen is if people are eating really healthy, if they've you know, worked on the hydration aspect, if they have been really taking care of themselves as much as possible, I do feel like people can get results faster if that's the case, right? It's almost like their body is already primed, and then you add something like the patches, you just see it work much quicker in people that have done that. So I do think that that is a factor as well. And David Schmidt, the creator of LifeWave and these patches, also references that in his videos. And certainly when we saw him live at the LifeWave conference as well, he reinforces that. So if you're living a healthy lifestyle, it really makes a difference in the type of results and how quickly you see results with this technology. And sometimes we just have to go through the process, you know? So a lot of times people, when they start it, if they haven't done those types of things, they might go through a detox initially before they start to see the positive. They'll kind of see some symptoms of detoxification, which is necessary. Mm-hmm. Yes.
So great. Thank you so much.
Yeah,
we have a few minutes left, but does anybody have any questions for Char or for Dr. Caroline? You can unmute yourself.
There we go. I'm sorry, I was pushing the wrong button. I have, yes, I have a couple. But one thing I wanted to say, I am so amazed. I'm so thrilled at what's happening with Char. Couldn't wait to get to her, and she's just been the poster child. It's so much fun. So I have a question. So we have X39, which is regenerating our body and sending out the stem cell. And all the other patches are doing so many different things for our bodies, making them better in so many ways. So I have a question about ice wave. Is it also making, we have pain in a certain area, is it also making that area better, or is it just relieving pain? Can you help me with that?
My understanding is it's just relieving pain.
Okay.
Yeah, so that's why, like, if you want to see regenerative effect, you would want to also use the X39 and the Eon, in my opinion, along with Ice Wave. Like, if you want to get that regenerative, like, a lot of times people will have chronic pain for long going because there is damage in the body, but the body's not healing. Many times the body doesn't have what it needs for healing to take place, or they're not able to stay in a state long enough for healing to occur, right? And so those are factors. And so the Eon really helps get a person into the state where healing can occur. And then the X39 with the stem cell activity can really help promote that healing process, that regenerative process. So Ice Wave in of itself is great for pain relief, but it's really just working for that. And you want to combine those other two patches. As the tissue heals, one way that you'll know is because you'll have less of a need for the Ice Wave. You know, you'll be getting better, and yeah, you'll have less pain, and you will need the Ice Wave less frequent.
Okay, so I have this friend who has X39 for a month and a half, and he's had Eon, and ice wave, but he's better, but not way better. Any suggestion?
So, I mean, I always usually recommend if somebody just started with the patches and, you know, and they're not seeing, you know, a lot of change right away.
Mhm.
One of the questions is, you know, are you being consistent every day? So that's certainly a question. Another question is to look at their hydration status. And hydration is hugely important. And I will say that even I'm just going to speak from my own experience. Living in the desert is pretty challenging. It's hard to remain hydrated, you know, being in such a dry climate. And I have drank coffee every day, not a lot, but like 8 ounces for about the last, you know, 30 years, or no, probably 20 years. And I had a hard time, and I would just drink alcohol occasionally, just like socially, like maybe like once or twice a week at the most. But I noticed as I've gotten older, hydration has been a major, major challenge for me. And I recently was told by somebody that they could tell from my tissues that I was a coffee drinker. And so I just chose to stop drinking coffee. And I also chose to like stop drinking alcohol for a while. And that was about 4 months ago. And my hydration is completely different. And so I'm noticing a difference in how I tolerate, not just tolerate, but how I feel with the patches. Because before, when I was drinking coffee every day, and I wasn't drinking as much water as I should necessarily every day, so a lot of the things I was drinking, I've replaced with water. So it's a combination of not drinking the things that were dehydrating me, along with drinking the things that do hydrate me more so. I'm so noticing so much more with using the patches, and I'm able to do it for longer without, you know, signs of dehydration. It just makes a huge difference. So that is one of the things I would say is ask a person questions around, you know, how much water are they consuming? Mineral status matters too. So they have to make sure and get enough, you know, electrolytes in addition to water. And then how much are they drinking things like coffee and alcohol? Like how frequent is that? And as much as a person might not think that's having an impact, I'm telling you that it can, you know. So those are questions, those are considerations as far as people's results. And then those are some of the first things I would consider. And then as far as pain relief, ice wave placement is key. So sometimes people will they'll be following the directions of how to put the ice wave on and they're not getting relief. But it could just take some tweaking of placement and it would make all the difference. And I've had patients tell me that, like sometimes with certain areas, they might have to play with it for a little while to get the proper placement for them to get pain relief.
We've talked about that, and they've tried putting it all around. So recently I told them, how about stacking and see if maybe that helps. And then today we had another conversation, and I says, how about if we stack the X39? He's a little bit stubborn. Let's put it this way. Like I talked to him about coffee, and he said there's no way he's giving up coffee. And so I said, how about if you stack the ice wave with X39 in the middle, right on the spot. So they were going to try that today. So we'll see if that made a difference.
Yeah. And I mean, you know, I would say, like, if you would have asked me to give up coffee 6 months ago, I would have said no too.
Yeah.
So I just had to get to a place where I was like, oh, okay, yeah, it's worth it for me to give it up. And now it's like I occasionally will have like a latte, but I'm not doing it every day like I used to. And it's made a big difference for me. But so it's okay if he's not willing to do that, but it's just if you're doing those things that are dehydrating, you just got to make it up with the water. You just got to try to, you know.
Okay, so the minerals.
Yeah. So
Himalayan.
Himalayan salt is great for the sodium aspect. You want to have some potassium source as well. So sodium, potassium and magnesium are kind of the big ones, as far as I would consider magnesium an electrolyte too. So, and you could do a couple different things. Somebody could try with the salt. Sometimes I found that my patients have challenges with that, like especially if it's not being measured, it can be a challenge to get enough, right? To get adequate amounts. It's that balance between enough electrolytes versus how much water, because you could, if you're consuming the electrolytes, but there's not enough water, then that's a problem, right? If you're not enough electrolytes and a lot of water, then that's a problem. It's that balance between those two things is what you have to find. Sometimes the electrolyte drinks are easier because they're measured, they're measurable. So sometimes they're easier and you know exactly how much you're getting. Plus sometimes people have trouble drinking like plain water. So some of the electrolyte drinks today, they're sugar-free, they're flavored. So it might contribute to them drinking more because it tastes better. You know, it's possible. I mean, those are all questions for him. Going back to placement for Ice Wave, you know, you can try it with, well, one of the things that's recommended too is the 7 steps for pain. And I'm not sure how familiar you are with that. But there's a video and then recommendations for how to add the patches, different patches to get the result. But the 7 steps for pain is, if that's what you're trying to help a person with, is also a great way to approach it. To try the different patches to get him to where it needs to be. The other thing would be, a lot of times you're putting the brown patch on and then you're putting the white patch in a clockwise fashion. Sometimes if it's like a joint, like a knee or shoulder or something like that, I'll go through the body. So I'll put the brown patch on one side and I'll put the white patch straight through directly on the other side. And so that's another way it worked for me.
We started out with that.
Okay.
And that didn't do much, and so then we tried the clockwise, and that it's better. And you know, the other thing is they go dancing 4 or 5 nights a week. So, and his knees, you know. So you said something like Tapion, and with the minerals, you said something else, and I didn't get what it was.
Well, I said about the electrolytes,
Yes.
about doing the electrolyte packets.
No, it was more like I thought I said something about Himalayan salt, and then you said, or you could use
Potassium.
potassium.
Yeah. So
Oh.
I was saying, because there's sodium, potassium, and magnesium, and those are really
Yes.
the 3 main ones that you want to think about. And yeah, and I would say, like, if he, for convenience, say he was going to do electrolyte packets, I would just say that he would do the sugar-free, right? A sugar-free type, or type that's sugar-free, you know. So like LMNT is one that's popular. I've recommended that to patients. And then there was another one that Dr. Christine shared as well that looked really good too. That was another one. And if you want, we can share those in the group, the group chat, like which ones are good. But yeah, a lot of people don't focus on the electrolyte aspect, but it can make a huge difference with a whole lot of things. You know, just being not adequately hydrated could change a lot of things in the body. Like I'll just give you a good example. Like your mucous membranes are dependent on hydration, and you think about your stomach lining as its mucous membrane. Just being dehydrated can contribute to things like gastritis. Just being dehydrated. Yeah. So that's just one example, right? One example of being chronically dehydrated could, and then if you have that could lead to a whole bunch of other things, right? So it's just good to be aware. Yeah.
Thank you.
Yeah, absolutely. And like, you know, if any of you experience that with trying to help someone and you have them using the patches and they're not necessarily seeing the result that they expect, sometimes it can require some troubleshooting. You know, not everybody, again, kind of like I was saying earlier, depend on what kind of state you're in when you start. using these patches is going to affect your experience. So if you have somebody, and there, like I said, there's a lot of people, including myself, that have been chronically dehydrated for many years. And there's all kinds of symptoms and signs of that, but they don't necessarily relate it to, dehydration, because they're not like on their deathbed, you know what I mean? But
Mhm.
the reality is, yeah, you can see it in your skin, you can see it in your sinuses, you can see it in your elimination. There's all kinds of ways that you can identify chronic dehydration. And if a person has a history of like kidney stones, the number one contributor to kidney stone develop is dehydration.
Interesting.
Yeah.
Hmm.
So you just want to be aware of that and understand that that is one of the things that has to get better for them to really see the benefit from this technology is their
Wow,
hydration. Mhm. Super important.
I
great.
know, Dr. Caroline, you needed to run, so we don't want to keep you. Anyway, we just thank y'all so much for being here tonight. And what a blessing your story is, Char. You are going to help so many people. Just thank you so much for being willing to share with us tonight. So if y'all
Absolutely.
need anything or have any questions, please feel free to reach out to Dr. Caroline or I, or Vicky or Ed. There's lots of people on this call that have lots of knowledge. And so whoever invited you to the call, please get back to them and they will be more than welcome to help you with whatever questions you have. So thank y'all so much for being here tonight.
Thank you, Char. We
Thank
appreciate
you.
you.
Good night.
Have a good
Happy
evening.
birthday. Happy birthday.
Thank you.
Yes, happy birthday.
Thank you so much. Thank you, guys. I really appreciate you. Thanks for coming on the call tonight.
Thank you, thank you.
You're
Happy
welcome.
birthday, Dr.
Happy
Caroline.
birthday,
Aw,
and thank you.
you. Thank you so much. Love
Bye-bye.
you guys. Love you guys.
Good night.
You too.
Bye.